Presentation by the Colorado Springs Health Foundation. Julie Crow, Executive Director, Human Services, and Kari Davis, Director, Colorado Springs Health Foundation.
Good morning, Commissioners. Thank you for having us here today. Julie Crow, Executive Director, DHS, and I'm just here to introduce BJ Scott and Kari Davis. We've been working closely on a number of issues, and I'll quickly describe those for you. But BJ has been a community leader for many years. You may know her from her days as CEO of Peak Vista Community Health Centers and of Peak Vista Foundation. Since retiring from Peak Vista, she has continued to dedicate herself to community efforts through many volunteer activities and also through consulting. And she is here today in the role of board chair of the Colorado Springs Health Foundation. And we also have with us Kari Davis, who has lived and worked in our community for many years. You may know her as a former director of TESSA, our local domestic violence and sexual assault victim services program, or as the former senior leader at Memorial Health System. Since 2015, Kari has been the executive director of the Colorado Springs Health Foundation. A few of the efforts that we've been working on together have really been around being a thought partner in terms of some of the efforts that DHS is working on, such as partnering to expand our behavioral health providers in our local community, as well as our physical health providers. We're working on a child abuse prevention plan in our community, which involves about 30 different partners, and they've been a great thought partner in terms of that. And we're also working to bring more substance abuse treatment programs for particularly some of our pregnant women in the community, and they've been a great advisor on that effort as well. So it's just been a pleasure to work with them, and I'd like them to come up now to tell you all about their programs.
Well, good morning, and thank you for your time this morning. We're pleased to be here to just give an update of the activities of the Health Foundation. As Julie said, I'm the current board chair of the Health Foundation, and I'm one of the original members since the inception of the Health Foundation. So, let's see, there we go. It might be helpful to start with a brief history lesson. So in 2012, the voters approved the lease of Memorial Hospital to UC Health. And embedded within that agreement was the direction to establish the foundation, excuse me, to address health issues in Colorado Springs and the Memorial Health System service area. So we were appointed, the original board, in 2013, and during the time, if you jump to the end of 14, related to the PARA settlement, we spent that amount of time as a board just working on governance policies, setting up the organization. We did numerous focus groups all over El Paso and Teller County with key stakeholders and citizens to just understand what the issues were related to health from their perspectives. And that, of course, formed the basis of our governing documents and some of the things I'm going to touch on. So at the end of 2014, that PARA settlement was completed. It released money that was held in escrow, and we could now begin the work that we were established for, which was to address health issues and make grants in our El Paso Teller area. A big step forward was in 2015 when we hired our first executive director, and that is Kari Davis, and she has done a fabulous job, and you'll hear from her in just a couple minutes. And then in 2016, we started our grant making. So here's just a list of the current trustees and staff. All but 2 of these trustees were the original appointees by the city council. Mia Ramirez has replaced Phil Lane when he resigned, and Martha Barton replaced Zach McCumsey upon his resignation. And we are now big and mighty with 2 staff. So this is some of the work we did prior to starting granting. We had to determine our mission, our vision, values, geographic scope, and what kind of grants we were gonna give out. So you can see there, our mission is really intended to get at short-term or immediate healthcare needs, and then upstream. The Encourage Healthy Living was to really address those kinds of things that can really move the needle related to healthcare. Of course, the vision is listed there. Our geographic scope is, as in the founding document, was Memorial Health System service area, which according to Memorial Health System documents was identified as El Paso and Teller County. The values were really important to us in terms of how we would approach grant making in our region. Integrity, stewardship, collaboration, innovation, and leadership were values we identified. Our granting is around these types. We will grant general operating, program-related grants, capital grants, and capacity building and technical assistance. Our asset size currently is at $127 million. And so our payout has been almost $12 million since we started. You can see there that almost $9 million has been paid out. We have about $3 million that we have committed in the 1920 timeframe. Another area that we worked on before we started launching was what was going to be those funding focus areas. What were we going to give money to? And this came as a result of those many focus groups that I mentioned. We knew we needed to expand access for those in greatest need, so access was no doubt going to be on the list. There are healthcare workforce shortages in our region that need to be addressed, and so that became one of our focus areas. Of course, suicide is an issue in El Paso Teller as well, and so we wanted to focus some funding on that. And finally, cultivating healthy environments, and that really gets at in high-need, underserved areas, built environments, and Kari's going to highlight a couple that we have made and also related to nutritious food access and consumption, even including school projects. Finally, I think it's important to note that after a year or so of operation, the little footnote there is the Board of Trustees did approve that we may consider funding for potential opportunities to improve our health, assuming it still relates to our mission. That might be outside of these focus areas, but which just bubbles to the top in our community. So we wanted to remain flexible and have the ability to pivot if we needed to fund something and not be tied strictly to these focus areas. To date, we haven't had any of those come up. And Kari's going to come forward now to talk more about the funding that we have made and the grants to date.
Thanks. Good morning, Commissioners. Kari Davis, Executive Director of Colorado Springs Health Foundation. To provide a little bit more detail around our grant making to date, we looked at a couple of things. Number one, BJ mentioned that our mission really gets at both prevention as well as immediate need sorts of issues. So one of the ways we view or analyze our grants is through that lens. You can see that about 2/3 of our grants, a little more, relate to healthcare access. Some of those are prevention grants, but many of them are more for immediate needs. And 25% of our grants to date have been around healthy environments, which is more of a prevention upstream approach to helping people move more and eat better. One of the things that we also want to be sure of and check in on at least an annual basis is that our investments are aligned with community need. At the end of the day, we're here to serve the community and to help the community improve its health. And so if you look at any health needs assessment in El Paso or Teller County, one of the first things that you'll see is mental health, and substance use. Those things are #1 on everybody's list. So we looked at our grants in terms of mental health, substance use, and suicide-related grants, and about 1/3 of all of our investments are to that end. Let's see. I am struggling. There we go. Sorry about that. A few examples in terms of the grants that we've made so far. Under access to health care, we've made a grant in support of respite care. This is to help people experiencing homelessness who are transitioning out of the hospital have a place to recover. Project Angel Heart, which does medically tailored meals for the chronically and terminally ill. Mount Carmel, who provides behavioral health services for veterans. We've made a couple of our larger grants have been around workforce shortage, Peak Vista's family residency program and UCCS's psychiatric nurse practitioner program. Suicide prevention, we've funded quite a bit in Academy School District 20 that has suffered quite significantly in terms of youth suicide deaths, as well as NAMI. And in the healthy environment domain, I pulled out a couple that relate most closely to the county. We funded the Widefield Park for the county and a food assessment through the public health department locally. So those are just a sampling. Of course, we've made 151 grants, so there's a lot. I'm happy to answer questions on specifics, but those just give you a taste for things. Grant making is our primary purpose, but community education is also something that we feel strongly about. We believe that it's important to engage with our community to both learn from them and also help inform them about health issues and how we can work together to address them. So we've been hosting learning sessions about once a quarter, once every 4 months, and they've spanned everything from national health policy to a panel discussion on mental health and substance use to most recently an update on the most recent legislative session as it relates to health matters. We also partner with local organizations to offer learning opportunities like workshops on how to collaborate better and with the Business Journal in terms of their recent opioid forum. Looking forward toward the end of the year, we anticipate paying out or awarding another $650,000 in grants. That'll bring us to hopefully a grand total of about $4 million in payout this year. And this ties back with Julie's point. One of the things that we're testing out in third quarter is a funding opportunity aimed specifically at addressing child maltreatment-related trauma. So that's both preventing it and or healing it. We know that trauma is a root cause for many of our health concerns, both here and around the world. And we also know that unfortunately El Paso and Teller County have a much higher rate of child abuse and neglect than our state. So we feel like this is an opportunity to address a key community need as well as get upstream for some of the major health concerns that we face. And we also continue to convene smaller learning sessions, we call them learning circles, on particular topics to further our general knowledge of what's happening in our neighborhoods and communities and how we might help. So with that, that's just a quick overview in terms of our grant making. We'd be happy to entertain any questions or comments.
Commissioner Vanderwerth.
Thank you, Mr. President. First of all, thanks very much for being here. I've learned something about your organization when I didn't know much about it before.
Good.
So that's great. There is something that I just don't know if you've had an interaction with this group, but you know there is a nonprofit that took over the county's detox center, and that's Crossroads. Yeah.
Yeah.
So of course they're working on kind of adding a medical component to strictly just a detox center. But there was another thing they did that I thought was really, really interesting, and I'm very interested in it being successful, maybe working in a community partnership, and that's going into the high schools to talk about prevention for alcoholism and drug use. So I just don't know the status of that, but it seems to fit right in your wheelhouse, right down your center lane, as maybe a nonprofit organization that's worthy of looking at, because the more we can do in prevention, the better off everybody is, the better off the community is. And if you haven't maybe had an opportunity to talk to them about that, I would encourage you to do that. There's probably plenty of other nonprofits that are doing the same thing, and I just can't speak to all of them, but I do know that Crossroads, when we were going through the process of of them taking over the detox center. I was really excited about these other services that they were offering as well, and I thought they'd be good to look into. So that's my comment, and thanks for being here. And I would like to come and meet with you sometime and just learn more about the organization. Yeah, thanks.
If I could just respond quickly to that, actually Crossroads Turning Point is one of our funded partners. We funded them in May. It's a 3-year grant in support of their detox efforts. And in the process of talking with them before they submitted their application and making the award, we did become aware of their approach to this work, that it's not just the acute intervention for detox, but that they have other services that wrap around that. So we're looking forward to seeing them grow and evolve in our community, hopefully serve it very well. They certainly have lots of experience in Southern Colorado. So thank you.
Great. Outstanding.
Great. Any other questions? Fantastic.
Okay. Thank you so much.
Thank you so much.